So we are presenting an NN study to see whether sleep patterns are associated with any cardiovascular outcomes. There has been one study in '97 which was just which read this enhanced data, but that was old data first of all, and they just reported 2 outcomes. We have reported the most recent database from the enhanced, and we have studied 5 outcomes. And this is the first time that a study has shown that sleep pattern has been associated with 5 outcomes, that is coronary artery disease, angina, myocardial infarction, stroke, and congestive heart failure. So basically we had 10,000 patients in the sample. In the end we had 3,000 patients for each outcome, and all these 3,000 patients was seen whether were grouped according to less than 6 hours, 6 to 8, and more than 8 hours of sleep. And then chi-square tests were run for the baseline data, and then we also adjusted all this analysis for blood pressure, cholesterol, diabetes, smoking, gender, age, race, everything that can lead to a cardiovascular confounding. And the one major strength of the study is that we also adjusted for sleep apnea. There is a recent meta-analysis by Cappuccio et al. In European Heart Journal, but in the limitation they mentioned that none of the studies was reporting sleep apnea as the confounder. So we have also adjusted for sleep apnea in this study. So this is a retrospective study. So drawing any conclusion for it is not a good idea. The only conclusion from this study we can say is that sleep patterns are associated with the prevalence of these outcomes. We should not draw causality for that, but still it's enough meat to draw conclusions that further studies are needed in this regard, first of all. And it's kind of hard doing a study, prospective study with this question, because you cannot control how much people can sleep every day, right? So as far as this goes, this is probably the most we can do, or we can have a bigger sample later on. And right now we propose that it's a very small thing that you just ask the patient how much are you sleeping. So it doesn't take time, doesn't cost you anything, nothing. So if in the future it can be proved that this is actually a risk factor, so we can put this as a separate risk factor and start asking for it, and start, if patients are increased at risk, so we start treating them more about it. This is what we are presenting today. The findings actually are people who were sleeping less than 6 hours, they had increased risk of congestive heart failure, myocardial infarction, and stroke. And people who were sleeping more than 8 hours had increased prevalence of coronary artery disease and angina. So this is what we saw. And we had odds ratios, we had confidence intervals to see everything, and this is what we found in the end. 6 to 8 hours is the best sleep according to some previous studies and this study too.